I'm Amanda. Today we're going to be doing a barium enema. I'm going to start with our supplies. The first thing that we need is a barium enema bag. I'm going to take the barium contrast. It is a high density, low viscosity. We have to mix that up. So I'm going to mix that with 5 milliliters of room temperature water. I want to make sure it's completely mixed up so there's no chunks. I've gone ahead and bled it down the tube and I've clamped it with a hemostat. What we have attached to the barium bag is the barium enema tube. It is a double lumen tube. 1 lumen goes in. We will use the cup inflator to inflate the catheter balloon once the patient is tipped. And then we have the air pump for the air tube. When the radiologist is in here, we'll add the positive contrast to the double contrast study. I'm already wearing my gloves. We have extra gloves if we need them. We have lots of towels to use if we need them. We have tape. I'm going to end up taping the enema tube to the patient's leg just so that it doesn't fall out when we're trying to move it around and position them for the x-rays. And we have jelly, lubricant. I'm going to put a generous amount of lubricant on this enema tube before we tip our patient. And let's go get our patient.
Hello. Hi.
My name's Amanda. I'm a radiographic technologist today. Can you just tell me your last name and your date of birth?
It's Asefa, 12/20/88.
All right. And what brings you in today?
Constipation.
Okay. How long has that been going on for?
About 2 weeks.
Okay. Did you get informed what's going on in this procedure? Did your doctor tell you what we're going to be doing today with the barium enema?
Yes.
Okay. And did you do all your preparations? Have you fasted for 12 hours?
Mm-hmm.
Okay.
Yes.
Last question, is there any chance that you might be pregnant today?
No.
Okay. So I'm going to have you change. Here's a gown.
Okay.
If you could take your bra off and your pants and underwear off.
Okay. Perfect.
And we will get ready when you're all changed. Okay. All right. So we already took the AP Scout image just to make sure that there's nothing in her small bowel. Now we have her in the RAO position, and now we're ready to tip. So we're gonna get ready to put the enema tip in,
Okay.
and I just want you to take some big deep breaths.
Okay.
Try to relax. So the first thing, squeeze some lube down. Make sure we have a lot of lube on the enema tip. Our cup inflator is attached for when we have to do that. I have tape ready, and I'm gonna get some towels just in case we need them. Those are ready. Okay, now it's time to tip. So I'm about to insert this. I want you to take a big deep breath. I'm gonna pull her left buttocks to the side, and now we're gonna start tipping. I'm gonna go in 1 inch anteriorly, and then I'm going to go 2.5 inches superiorly towards the belly button. Now I'm gonna take the cup inflator. We're gonna give it 1 squeeze only. That's gonna inflate the balloon to keep the enema tip in place. I'm going to take this to her leg so that it's not moving or doesn't come out when she is moving for our different positions. The last thing, we do not want the enema bag to be more than 24 inches from the patient, 24 inches above the patient, because that would be way too much pressure for the barium once we release the hemostat. And now let's get ready for our images. All right, so now it's time to take our first x-ray. We're going to be starting with the right lateral decubitus. For this, our CR is going to be, the IR, we want to center it to her mid-sagittal plane and at the level of her iliac crest. I'm going to shield the patient. Your arms up like that. All right. All right. I want my patient nice and close to my plate. And I'm going to give you some breathing instructions. Blow all your air out and hold your breath out. Shooting x-ray. That x-ray was taken at, for Kiki, 25 mass, 120 kVp. Alright, so now we're going to go on shoot the right lateral rectum. So I'm going to move the plate. Somebody didn't put the, there we go. Back down to 40 inches. And for this projection, we want to come down to a 10 by 12 because we're just looking at the rectum. And for this one, we're going to center on her mid-coronal plane and at the level of the as-is. Make sure I'm lined up with my buggy. Good. I'm going to come in 10 by 12. Alright, and now we're going to use our right marker. She's on her right side. I'm just going to put that right on the edge of the light next to her body. One more time, I'm going to have you take a breath in, blow it all the way out, hold your breath, shooting x-ray, go ahead and breathe. Alright, so now, now we're going to go back into that position that we started in. So I'm just going to have you roll a little bit more over onto your, roll down towards your tummy, yeah. But keep this hip bent, knee bent, good. And can you just move with your arms a little bit, put that one back, perfect. So now we're going to be doing the PA oblique RAO position. We're still keeping the IR in the table buggy, keeping it at 40. Rock back just a little bit less. For her, I would say oblique her at 35 degrees from the table. Should be good. We're going to open this back up to 14 by 17. So, and what we're going to be doing here to center up the IR, it's going to be at the level of her iliac crest, and it's going to be like 1 to 2 inches for her since she's tiny, maybe only 1 inch lateral from where her mid-sagittal plane is. Alright, and she's on her right side. So I'm just going to put the right down. Alright, one more time. Take a breath in, blow it all the way out, hold your breath out, shooting x-ray. Go ahead and breathe. All right, can you roll all the way down onto your belly for me? Now we're going to be doing the PA position. Again, at 40, the IR is going to stay on the table, Bucky. For this one, we want to center at the mid-sagittal plane at the level of the iliac crest, so we should be pretty close at this point. All right. One more time, take a breath in, blow it all the way out, hold it out, shooting x-ray. Okay, go ahead and breathe. All right, so now we're going to do the axial view. For the axial view, we want to center at the same spot. So I'm going to move my tube down a little bit. And this is going to be at an angle of 30 to 40 degrees. Since she's tiny, I think 30 is going to be good. The axial view is done again at the mid-sagittal plane at the level of her iliac crest. Let me make sure that my Bucky is aligned with the tube now. Okay. Right marker's down by her right side. Okay, one more time. Take a big deep breath in, blow it out, hold your breath out, shooting x-ray. And breathe. Let's take this tube angle off. So now I'm going to have you roll up onto this left hip. So bend, I'm sorry, your right hip. Yeah, your left hip. Your left hip and your right knee is going to be bent. Okay, perfect. Can you actually switch arms? This arm's going to be down and this one is going to be down behind your back. Perfect. Again, this is 30 to 40, or 30, 40 degrees oblique for her since she's tiny. I'm going to do 30. That's okay. Arm down by your side. Sorry, my phone ran out of batteries. All right, so right now we're doing the PA oblique LAO. For her, she is 30 degrees oblique. I am centering my R midline, the mid-sagittal plane, and at the level of her iliac crests. Since her left side is down, I'm going to mark the left side just outside the window here. All right. One more time, I'm going to have you take a big deep breath in. I got it. There you go. One more time, big deep breath in, blow it all the way out, hold your breath out, shooting x-ray. Go ahead and breathe. Okay. So now we're on to our last projection. You can just get comfortable on your belly or on your side. The next one's going to be onto your side. Okay. The last one we're doing is the left lateral decubitus. So let's get our Bucky out. Since it's a left lateral, I'm going to mark this left. Okay, Kiki, I'm going to have you roll over onto your left side, and I want you to scoot really close when you're, I'll say yes, scoot really close to that board. Just keep that arm up by your face, please. There you go. For for this one, we are going to center it at just the mid-sagittal plane at the level of our iliac crest. And we don't want light on the board like that. On the wall, sorry. 14 by 17. Sagittal plane. A little bit low, I think. Okay. She's in a true lateral position. Let's make sure we're no more than 40 inches away from our Bucky. We're at 41. One more time, take a big breath in, blow it all the way out, hold your breath out, shooting x-ray, and breathe. Okay, so that was it for the series of images. What we're going to be doing now, I'm going to drain the rest of the barium out of the patient. I'm going to deflate the balloon, remove the enema tip, give her some towels, and let her use the restroom. When she's all set, we're going to bring her back to the table, and we're just going to take a posted back image. That's just going to be an AP. And that was the barium enema.